gentlemen, I just want to remind you that we actually have an email list and we would love you to join us. If you want to sign up, go to www.thewizardandthepriestess.com and find your sign up button. Join us today. Welcome to The Wizard and the Priestess. I am Nuala and this is...
I am Matt.
We are here from our studio with our studio audience who are currently asleep. And we'd like to keep it that way. Hope you're enjoying your drive home, everyone, or your drive to work. I don't really know what people do when they listen to our podcast. Can you write it in the comments?
Yeah, actually, that'd be good to know.
It'd be nice to know what you're doing and we can maybe...
We'll make it fun for you.
Yeah. All right.
So we had a question.
We did have a question. We had someone come in and they wanted to know...
It was quite vague. It's one of those questions that... It's like one of those questions of what should I eat questions. What are you laughing at?
Nothing. Go on. Yeah, what should I eat? Well, what should I eat, Matt?
No, that's not the question. It was like that question.
Okay.
It was how do I get rid of lower back pain?
Ah, the illustrious lower back pain.
The old
That old chestnut.
LBP. If you would write clinic notes.
Oh, gosh. I get really confused with the abbreviations these days. There's so many and it's just like, I think I stepped out of the clinic for much too long and now I can't even read text. There's abbreviations left, right and centre. And the hardest thing for me is I thought it was young people that do the abbreviations, but now it's like...
Yeah, we do.
You would have no idea of the abbreviations that exist these days.
That's all emojis now.
I'm good with emojis. I speak through emojis. Emojis is like clear. Yeah. That's just like looking at someone in the face. Oh, you're smiling. You're winking. Mm-hmm. You're sticking your tongue out. So,
someone comes to you in clinic.
Yes.
Lower back pain.
Yes.
What's your immediate, I guess, not necessarily approach, but where does your mind go?
Well, straight away I would ask them what they've been doing and what makes it worse. Mm-hmm. And if it is something and then I would be dissecting or working out what is that feeling that they're activating. So a lot of the time I will get someone who is have pain when they do a particular thing in the gym. Or that's where it started and then they kept walking or they lightened the load and they did something differently. But the same, you can kind of hear in their voice and the way that they express what particular emotion is coming up for them in that. Now, it could be, there's a few different things, like traditionally in Chinese medicine, it would be fear. We'd be looking for fear, the lower back, encompassing the kidney area correlated to the fear. We would be looking towards something that is kind of fear-based. Most of the time, I find fear is hidden. And so you'll see the compensating energy. And that could be anything from anger to striving to... Could come off as worry and anxiety, but it's more than likely with lower back pain, it is... there's a part of responsibility in that, even though that would be more correlated to the shoulders, but there's the fear and you find it'll go kind of left or right. So it could be excess or deficient. Mm-hmm.
What's it? Is left inefficient?
It's not necessarily left or right in that sense, but it's more...
it depends what's going on.
It depends what's going on. So you could have an excess of fear, which would mean that you can't leave the house because you're so afraid, or you could have a deficiency in fear where you actually aren't afraid of anything and you don't know what danger is.
Yeah, we spoke about that in is that the kidney?
Yeah.
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 So I was paying attention.
Good job.
Yeah.
What about you, Matt? What would you do when instantly someone walks in and says, all right, Matt, I'm here for you for my lower back pain? Because for me, people don't necessarily come in with that initial. It's usually, I've got this thing and actually the lower back pain for me is usually a piece of the picture.
Oh, anything's a piece of the picture.
Oh, yeah, but people would come to you with lower back pain.
I want to know, what happened? Did something happen? Yeah. Or do they just wake up and it's magically sore? If it's magically sore, it's likely been days, weeks, months, years in the making. Then if it is sore, what's the quality of the pain? Is it stabby? Is it burning? Does it travel? Is it dull, catchy, etc.? What's the quality of the pain?
What does catchy mean for you?
Like a...
I know what catchy is,
Well,
but...
for me, it'd be if you're sitting down and as you're about to stand up, it sort of just grabs you.
And what would that be for you?
Well, it's a problem with extension.
Okay.
So that narrows it down to 10 things.
Cool.
So I'm in my thought process, I'm trying to not kind of unofficially diagnose what's hitting what. Now, if it's being diagnosed as something, that's one thing. If it's been diagnosed as, say, a disc bulge, then I want to know that. So you get diagnosed with a disc bulge. That's the quote-unquote diagnosis. That's really the symptom.
Yeah.
Because what's caused the disc to bulge in that specific segment at that specific time on that specific side doing that specific thing. That's the real diagnosis.
Yeah.
So that's more of the treatment plan. But as for the lower back, I think it's 85% is idiopathic. So they don't know what's happened. So in that case, you have to do your own sort of detective work. And if they're coming up from sitting and it's caught, it's likely either some kind of stenosis or narrowing. It could be some kind of osteophytic change around the foramina or the joints. It could be a locked facet joint. It could be some kind of fracture, like a low-level pars fracture. But in any way, typically they're extension intolerant, so they can't arch back. Bending forward feels better.
That's when it's catchy. Or is that
Typically,
in general?
that's the classic pattern that you see. There are always
In the lower
exceptions.
back pain.
Yeah. And it could also be sacroiliac related as well.
Yeah, because I often find that I would treat the SIJ. Hang on, no, sorry. Like the adductors or the what's the other one down here? What's the one that goes all the psoas?
Psoas.
Like I'd find that that's the sort of for the particular people that come to me. So that could be that's usually like
I find psoas either goes into spasm or goes completely floppy.
Yeah. And that would you see that a lot with lower back pain for you?
All the time.
Yeah, so I guess from my perspective now, most of the time out on the internet, it would be like, if you've got lower back pain that's not going away, let's strengthen your abs. I know you want to talk about that, Matt. Talk about it. Great. So what do you think? Should I strengthen my abs to will that get rid of my lower back pain?
It will, as long as you don't do it from YouTube or a guy on Instagram.
Why can't I just do it for free? Why do I have to pay someone?
You don't have to pay anyone. It's more about lower back. So I'm getting almost triggered because I've had this conversation so many times in the last month.
Well, just have it now and then you can share this.
I do a lot
episode.
of telehealth
yeah.
work, and they will argue with me that their crunches are helping. Even though they feel their back pain afterwards, they're doing their crunches, but it's no pain, no gain. And because the ripped guy off YouTube or Instagram did it. So I'm going to follow that 7-minute ab workout every single day.
Why couldn't it be so easy?
So, I mean, yeah, I get it.
Okay, just go. All right. Talk about why it's maybe not helpful.
It's not helpful because the person on YouTube hasn't assessed you. They don't know your unique needs. They don't know your back or body. They don't know your diet. They don't know how stressed you are. All of that contributes to how you feel. Because if you're stressed, it's going to promote inflammation. If you're eating, let's call it suboptimally, it's going to create inflammation in the organ, which is going to create an inhibitory reflex response to the abdominal muscles, which are there to stabilize your spine. And if that mechanism is switched off, then it leaves your spine exposed. But there's no exercise to fix
that.
No.
All right, but is it going to make it worse?
Probably.
Because it's not being activated properly.
Well, it's not being...
Because my abs are abs of steel right now. They look good.
Look great. But then you could see a separation. You could see their back pain won't go away. They might look great in the mirror, but then you look at the rest of their posture, like a candy cane. I was just calculating what a candy cane looks like.
I just want to know how it looks. Yeah. Okay. Yeah.
So yes, you can strengthen your abdominals, but there's a way to do it. Most people think it's like planking and doing crunches from the ground.
You're pretty against plank.
very much against planking. Side planks, there's an argument for, but your classic, what you think of as a plank, no.
Why?
Puts too much shearing through the lower back.
So that puts pressure into the lower back. Shearing.
Shearing, like, puts a shearing. Think of the gravity going through the back at that particular angle. Plus, you can just lock your shoulders in and hold you there. So it doesn't really do core. The core is designed to extend, to flex, to rotate.
So what should you do other than come and see you and get a proper
I'm not
analysis?
saying to just come and see me. It's more just to be aware of the things that are out there, because there's so many, and maybe it's just because it's been in my, kind of been in my face recently, of all these influencers doing this lower back stuff and this lower back fix, and there is a way to do it and there's a way to really not do it.
Yeah.
And unfortunately, the people...
Why don't you just become an influencer then, Matt?
That's the dream, isn't it?
Well, what's stopping you from putting your 7-minute video out on YouTube? And
it's just too many variables.
Okay, so that's the thing. There are too many variables, and I think that we know that everyone is slightly different. So we do need to take that into consideration. And you are not eating the same thing that Joe Blow is eating. Your digestion isn't functioning the same way. So
relationships are different.
How would your relationship react to a lower back pain?
First thing that comes to mind is the word chakra. Second chakra, we hold the energy of our ideas relating to rhythm, pressure, flow, relationships, sex, sexuality, between T5 and L4. Sorry, T9 to L4.
Okay.
That's a big chunk of the spine.
And that's a big chunk of lower back pain. Mm-hmm. That is just it.
80% of disc issues happen at L5S1. Just under 20% L45. 0.01 in the thoracic. I can't remember how that's spread out through the neck. But anyway, we're talking about lower back. So it's either L45, L5S1.
Yeah.
So we hold that pressure from a visceral viewpoint in the lower parts of the colon, depending male, female. And
then coming back to the relationship part. So we have that second chakra correlates to our relating. In what sense?
Well, it's our relationship so the red ray or root chakra is about safety, tribal, etc.
Primitive.
Yeah. Then it's our relationships. What's my role in this relationship?
Okay.
What part am I playing here?
In is that relating to the world?
It's relating to the tribe. It's relating to the world.
So environment, relationship to environment, whether that's human, food, all those things.
All the stuff,
Okay. So then, all right. So what sort of person would you be most likely to see in that sense? Like what sort of relationship would they be in?
Usually modern day, likely in a long-term relationship, but things have just stagnated.
Yeah, and I would probably say that what felt like at the beginning, if it's a man with this, I feel like it's slightly different. It's seen differently for women because we hold our emotions differently or we experience our emotions differently. But if you are a man and you're in a long-term relationship, you are more likely to have lower back pain if you perceive the need to strive, to perform, to be and act a certain way for your partner.
Yeah.
A lot of the time that is coming from a place of fear and inadequacy.
Yeah. It's like always catching up.
Yeah.
Type feeling. And that's where you lose yourself within the relationship.
Yeah, because you're actually just doing what you think you're meant to be doing.
Yeah.
You're not experiencing or expressing yourself. And that's not to say that you can't. You just need to get to know yourself better.
Absolutely. That's hopefully the kind of
treatments that
the message that pain brings.
Yeah.
If you're willing to listen to it.
And that's a really, really hard thing, Matt, because who's really listening to their pain and going, oh, wow, I am not living out my truest self in this relationship. I just have sore lower back. I just need to go to the chiro and they'll align me.
Well, that's the thing with most lower back pain and why it doesn't really get better, because they go to the chiro and the physio and whoever else, and that's fine. That certainly has its place. However, the thinking that got them into the problem hasn't been addressed. And they can get the disc put in or that joint realigned, and that's fine. Then let's say it helps the L4-5, then that's going to go somewhere else. We haven't even spoken about the mechanical relationships of the spine and the neck. So there's that biomechanical relationship. So C2 can throw out L5, but no one really thinks to go beyond the lower back. So a lower back is very rarely just a lower back.
And I'd like to say that nowadays craftsmen that are healing craftsmen generally are being much more concerted in their efforts to make sure that they're not just playing on the outside.
Yeah, it is shifting.
It's definitely, I'm noticing more and more people, like the knowledge is out there, so you can't, you can do the simple treatment. So like for a TCM clinician, we would have been taught lower back pain, needle, bladder 23 or kidney 3, ankle points that are correlated to the kidney, or bladder points, bladder 60 and kidney 3 together, and like turn them in opposite directions and just tonify the kidney and reduce the bladder, and they're running past those channels and you're internally, externally treating. But now there is so much more depth. And I mean, that is already a distal treatment, so you're bound to get a really good outcome.
Is it for you distal proximal?
Distal proximal. Well,
Like start
or like treat
further away
distal
than
and
go-
then move closer.
Yeah.
I think it depends. You
Sure.
can do either or. I do either or. It just depends what I want to treat or how I want to treat. If I am treating a pregnant woman with back pain, I will generally massage her body because you want to be touched, and that's probably what they're lacking. Because one, they're probably not being touched in the way that were being touched before because their partner, like they're uncomfortable to be touched in the same way. It's funny being pregnant or carrying a baby. It's really hard to hug someone. Like you kind of do this awkward lean around and it sort of becomes a thing where you don't do it as much anymore because there's always a baby there. Or you do and you just lean in and you jump in and it's everyone's being squished. You forget about the baby or the pregnant belly in between. Or just the baby, I guess. But yeah, so I will generally touch and then I will use needles distally. But that's just depends on the person. But if it's I would like to do I think that's the thing that everyone wants, that relief. I have there's some beautiful techniques, like Master Tung is fantastic for quick relief for pain. I tend to move, I don't do a lot of pain, even though acupuncture has been, I don't tend to see people for pain is always a secondary part of my treatment. It's not a common, like you don't usually come to me for pain, but it's pretty cool to, there's so many techniques now where you can just so simply and easily get really fantastic results with just really simple techniques, which are usually distal. And that kind of comes to that, like I know that lower back pain and sciatica are they're very different, but they can be quite, I had a bit of sciatica and then I had lower back pain. It's sort of, from my perspective, they're not on the same pathway. But some people will say, oh yeah, my back, but actually it's sciatica because they're feeling it from the SIJ down the leg. So for them, it's their back, but actually it could be their back.
Yeah, if it's true sciatica, it'll be the sciatic nerve exiting from the spine. But if it's like a false positive, it'll be likely what I would call piriformis syndrome.
And do you want to dive into that?
So the sciatic nerve's approximately the size of your thumb.
God, it's thick.
It's thick, and it forms around in the pelvis, but depending on your anatomy, there's a rotator of the hip called piriformis. It's probably the most famous rotator. And I think it's the biggest as well. It goes from your sacrum to the lesser trochanter, and the sciatic nerve runs right through it in some people, right behind it in some others, and right in front of it in other people. So if that muscle gets really tight or agitated, then you can see how that would irritate the nerve. But then why does it get tight? It's usually trying to do the work of the glutes. If the glutes aren't switched on or the hamstrings are too tight, the glutes will switch off, so the rotators have to do the job of those other muscles as well. So they just become chronically tight, and over time that irritates the myelin sheath around the nerve, and that's where you get the referral down into the foot. And yeah, you'll know piriformis is kind of different to a disc. With piriformis syndrome, it feels like you need to elbow your own ass.
Elevate?
Elbow.
Elbow it.
You know, when you just need to get that ball into your bum.
Which makes sense because it's tight.
That's exactly where it is.
Yeah, okay. Whereas I would find most of my patients can't really touch it, like it hurts to, like, you know, you don't want to put
For
pressure.
some people, it's really sensitive.
And we have, I guess, the way I would treat would be whether it's going down the back of the leg, the side of the leg, or the inner leg, because that's going to tell me different where it's being.
All different things, yeah.
Where it's innervating. Yeah, okay. And do you have any, so coming back to what can you do if you're in a long-term relationship, you've got lower back pain, you can probably hear yourself in what we're sharing. Maybe I am under a bit of pressure from my partner or my person. Even if I'm young, maybe I'm feeling that pressure from my family to do and be something that I'm not currently. The physios told me it's because of the weights I was doing at the gym, and just to lighten the load and then do these exercises that they've given me that I'm not doing. What can I do emotionally to actually help? Like, what's an option?
Emotionally,
what's an option?
Have that, oh, for fuck's sake moment of, that's what's happening.
Okay.
I don't want to be doing what I'm doing.
Acceptance.
Acceptance. It's probably a better word.
Right.
That needs to happen at some point.
Need to find acceptance.
Just spot it. Put the flashlight on the shadow, we'll call it.
Okay. So I've got the flashlight on the shadow.
Yep.
Now what can I actively do?
Well, now if the pain is still there, so that's going to take the psychological or the psychic weight off the spine. Now, once we've taken the psychic weight, maybe we do need to get it assessed by a chiro, physio, check practitioner.
Sorry, can you wait for a sec? Acceptance. I'm sort of there. No, like I'm just pretending to be someone right now. But I'm sort of there, but like I'm still blaming.
Yeah.
How do I move through my blame so that I can find true acceptance?
So what are you blaming?
I'm blaming the other person. It's not my fault that I'm in this position in the first place.
But you're the one perceiving it. So what's being stirred in you? Do they have the same reaction?
Well, they need me to be like I'm the breadwinner of the family, or I need to be this person for our family. I need to make
and that puts a lot of pressure on you?
Yeah.
Why is that?
Because that's my tool. I'm the man of the house, and I'm meant to look after them.
Who told you that?
Well, I'm looking at my children, and if I don't work hard, then they don't get fed.
You said I'm meant to do that as the man. Where did that
come
from?
That's from obviously society.
Okay. Is that working for you?
Well, yeah, it is, because I've got this beautiful home, and I've got my kids are fed, and my wife is happy most of the time.
You haven't mentioned you yet.
Yeah, because I'm busy doing the things to ensure that their life is good.
And how's that working?
Well, it's going okay. I just got this lower back pain, mate. Can you just
You see the pattern here?
No.
Okay. Go see Noah. But sometimes victim works. If that works for you, then just you keep at it, brother. My feed just went up. No, but that is a good point, because you hear that all the time.
Yeah.
All the time, especially from the males.
Yeah.
Yeah.
Because I think lower back pain's a real common man disorder. Shoulders, necks.
Different phases of life.
Yeah,
Younger
absolutely.
men, older women, in my clinical experience.
Okay.
Not all the time.
Yes, I could see that.
But if I had to...
Well, it probably makes sense because the woman has given her all through her childbearing years, which served her. Mm-hmm. But then now it's not serving her, and she doesn't want to give anymore.
Yeah.
I see this. I'm going to change this, divert us a little bit, but I'm seeing this so much in the women of the day, especially my mum's, our parents' kind of age group, 60s, 70s, where if they weren't well supported through their childbearing years and their 30s and 40s, they are now feeling a little bit, you know, I don't know, digging their heels in a sense in their direction of life. Like they are now living for themselves. And I think it's quite interesting because since the Industrial Revolution, we've sort of had that pressure and push to be, you know, get everyone out of the home, get mum out of the home, get dad out of the home. Let's all work really hard. And then let's provide this space so that when we retire, we can then go and live our lives. But that's not how the family unit functions when we're living.
You had to work yourself half to death before you're allowed to enjoy life.
Yeah.
Yeah.
And this is where that whole guy, that man plays out. He's got all this pressure
That's the story.
Yeah, that's the story that we're being fed that needs to happen, that must happen this way so that one day we can retire and live happily.
Yep.
And it's an absolute fallacy because what I can see in how, not everyone, but there are many people in that 60s, 70s that I've seen, parents that are now trying to make up for the loss that they, you know, because I think if you were born in the 50s, you essentially were the first woman thrown into work, not thrown in, but like, you know, the first woman that actually had the ability to go to work whilst having babies. Prior to that, you didn't. The generation before, it wasn't an option. The kids needed to be cared for at home. And it's pretty. I think it's pretty jarring because there's definitely not two. There's more than two, but there's definitely lots of different ways now that the mother at home is she's exhausted, but the support isn't there. Because that support person is trying to live their life now. So it was a very interesting societal, and it's the same, it's societal movement. It's the same with only having 2 children. And I'm not against that. I think 2 children is a really great number. But there's such a, you know, the reason why we were only having 2 children was to try to depopulate the earth because we have too many children. But it sort of doesn't make sense also.
No, not a lot of it.
But I mean, it also makes sense in some perspective.
But the truth in everything.
But yeah, it's very interesting how society is sort of pivoting, and it's I think we're on the pendulum swing. We're currently swinging back, and hopefully we swing back and everything cracks. And I think that this is the year. This shedding of the snake year is actually going to make a lot of that skin crack. Those heels start to like really show what's underneath.
Yeah. I think coming back to the stress of it, it's that dynamic. The man always thinks he has to provide, come what may. Now the woman, you can maybe share what the woman thinks. The guy is trying to keep the peace, and that's all he wants. Peace, you to be fed, kids, but that's 98% of his bucket emptied into that. So therefore, if my bucket has now become so depleted, you can just tell me one thing, but you could be saying it in the most loving way because I'm that thin, spread out, empty. I'm going to perceive that as an attack. No matter what you say. You say something about the garbage. And that's when it happens.
Yeah, now I understand you, Matt. Feeling spread thin, doll.
Hello, everyone. Thank you for listening to part 1 on our episode on lower back pain. While Nuala goes off and does mum stuff, I am charged with the second half or part 2 of this episode. So I'm going to go into more of the clinical type stuff when it comes to lower back pain. Now, one thing that's really underestimated with lower back pain is venous circulation. Now, a lot of people, when they have pain, it's mostly at rest. If they have pain when they're moving, then it's likely creating more and more inflammation. However, if movement makes it feel better, and they're at rest, and that's when it starts to hurt, then there's an indication that there's an increase in venous circulation pressure, which means the veins that drain the waste away can't effectively do that. So what they do instead is hold the pressure, and as the pressure holds and builds up, the capillaries and veins expand, putting tension on nearby structures. So it can create the illusion of a denseness, heaviness, dull ache type of thing. So anytime we walk, we stand, the load of the body puts pressure on the discs. Now, pressure decreases when you move your foot forward. So if you're walking and swinging your foot through, that's when the pressure through the spine decreases. Pressure increases when you bear weight, when you are in a closed chain. So when your foot hits the ground, the kinetic chain is closed, or when you walk or run. Now, the disc will lose and gain water as it receives fluid and nutrients via like a sucking effect. So if you carry a load of about 10 kilos, it creates a tension of up to 100 kilos on the discs, and the disc is compressed and then loses water. So unless the disc is dry, it will regain water again in about 5 to 10 minutes. So when you're standing, the axis of the spine is at L2. Don't know where L2 is? Find your belly button, go directly behind that. That's L3. Go 1 inch up, and that's L2. One of the reasons we have so many problems with L2 is because it becomes the apex of the spine. When sitting, the axis is more L4-5. When we bend forward, we have 150% more pressure on the disc than when you stand. Side bending combined with rotation, arguably the worst thing you can do to stress the disc. So golfing, rugby, all those sort of passing, bending movements, surfing is another one. Typically young people, children, they actually have discs that are more solid than the vertebrae. So it's actually the vertebrae that gets fractured. That's because they can't dissipate the load effectively throughout the spine, because the disc's job is more of a shock absorber between each vertebrae. So now we can talk about causes of lower back pain, for which there are an absolute myriad of. So I'm going to use Paul Chek's model of the totem pole to explain how it's not really a lower back pain problem, but it's more of a body problem. And most therapists and coaches focus their work on the spot that hurts. So as I'm about to go through really briefly, is it's not always the case. So we've talked about how the psyche or our mindset or our emotions can affect lower back pain via a viscerosomatic response or a psychosomatic response. So first we'll look at the jaw. The jaw is a very, very, very sensitive joint. So I've read in some research papers that it's up to 80% of our proprioception comes from our jaw. So if our teeth don't line up, it sends a message to the brain that we can't eat, so we're going to die. So your nervous system will adapt any posture it needs to, in an attempt to essentially get your teeth lining up. And somehow I've just forgotten the top one, which is breathing. We've spoken briefly about breathing and how that can affect lower back pain. From a direct anatomical view, it can affect breath because the diaphragm, which is the chief pump of breathing, the cruise of the diaphragm, the tendon of the diaphragm attaches on to L2. So L2 is a very important site as we'll continue along. When the diaphragm goes into spasm, it's called spasmophilia, and that can send a reflex up to the neck and throw the neck out as well, which put tension in the phrenic nerve. The phrenic nerve is the only motor nerve innervating the diaphragm. Motor nerve means movement nerve. When we cough or sneeze, we put a lot of tension through the diaphragm and through the abdominal cavity. That can be enough to slip a vertebrae. Another sign that the diaphragm is involved with lower back pain is you get a stitch very, very easily. And that can be because the spleen can hold a lot of tension in it. So if you get a stitch on the left side, it's likely spleen. On the right, there's likely liver, potentially lung or kidney involvement as well. But if we can't get a proper breath in through the diaphragm, then the spine itself won't get pumped. If the spine itself won't get pumped, then the venous system can't carry metabolic waste away from the tissue to allow fresh blood in. So that's another way we can get pressure build up, but it can be all stemmed from initially the breath. We've spoken about the jaw. Now we get to the eyes and the ears. So how the eyes and the ears can affect your lower back. We all have a dominant eye. And in this day and age, with all the screen times and all that kind of stuff, we're likely to have a dominant eye. We're likely to develop eye tension, especially in one eye. And it will particularly affect the optic nerve. As we look at the screen oscillates. As the screen oscillates, it creates the optic nerve to oscillate. Then that tension gets referred into the optic chiasm, and then it feeds into the visual cortexes from there, which can actually lock up the upper neck, which we'll get to in a sec. But if you have one dominant eye, you're always going to rotate your head so the dominant eye is facing forward. That will often create a rotational torque, through the fascia, which will rotate through the rib cage, translate down into the rib cage, and then end up mechanically in the lower back, creating to the naked eye what would appear to be a scoliosis of sorts. But it's likely to be a functional scoliosis, so not something that you were born with, but something you have acquired in this journey that we call life. A similar event, we can call it, comes from the ears as well. We all have a dominant ear. So to the degree that it is asymmetrical with the other one, we will always lean towards the dominant side so we can hear the best we can. So it has a very similar effect as the eyes. The eyes just have more proprioceptive input than the ears. Next, we go to the upper neck. The top three vertebrae in the neck move the same as the bottom three vertebrae in the lower spine. So C1, C2, C3 move the same as L3, L4, L5. The sacrum and the occiput also move the same as we walk. It's called the Lovett-brother relationship. So a problem at C1 on the left, let's say, can and often does, in fact, research by the Lovett brothers who identified this relationship showed that any problem at either end of the spine showed that there was a mirroring effect in the lower part or the upper part, depending where it started. There was a 72% chance of the same dysfunction happening at the other end of the spine. So if you have a subluxed C1, which is the atlas, which is the first vertebrae in the neck, then there's a 72% chance that within 5 years you'll develop a similar type of dysfunction at L5, right at the other end of the tail. So we have this inverse relationship between top and bottom, bottom and top. Chicken or the egg is the real kind of question there. That's why a lot of people they won't seem to think that a lower disc bulge, for example, can be created by an atlas subluxation. If the atlas itself is rotated more than, I think it's 4 to 10 degrees, depending on what book you read, then it will create that rotational torque through the dura mater, which is the outer layer of the spinal cord, which ultimately attaches onto the end of the coccyx. So it can create a rotation through the entire spine. If you think about the foramina in which the spine holds the spinal cord, it's about 12 millimeters in diameter. The spinal cord itself takes up about 8. So there's not a lot of wiggle room in there, but the atlas has ligaments attaching into the dura mater of the spinal cord. So you can see at the top, if you were to twist the top, you would have a rotational effect all the way down into the pelvis. Now, the top 3 vertebrae are known as the goalkeepers to the spine because they regulate circulation to the cerebellum, head, and eyes. So any restriction, particularly on one side of the neck, will likely cause something to happen at the lower part. You won't consciously know it's up the top. You might just have a sensation of a tight neck or a muscle or something that needs to be released in the neck. But then a couple of years later or in due time, you will likely develop some kind of lower back pain. But it's been driven from the upper neck. And then the upper neck essentially gets told what to do by the head. So you can see how there's an endless array of potentially chasing one's tail in the lower back pain pursuit. Next, we'll go into the organs. Now, next on the totem pole would be emotions. Emotions are a floating symbol, which Nuala and I have spoken about extensively on this podcast. Emotions essentially run the body. If you think of the mind as the builder, the psyche as the builder, the emotions take you towards or away from what you want or what you don't want, be it unconsciously or not. Now, if you've ever had the experience of being in traffic and someone just cutting you off and you have a certain, let's call it reaction, then you'll know just how powerful emotions can be. But it's more about the unresolved emotional stresses that really kind of run our life, and they can unconsciously influence any outcome, even to the extent of ending one's own life. So now we go into the viscera. Pretty much any organ from the diaphragm down has a direct correlation to the lower back. We have the liver, which affects flow to the right sacroiliac joint, the stomach to the left sacroiliac joint. You've got the pancreas and the duodenum, which cross over T12 down to L3. Any organ crossing the spine has the capacity and capability to lock up spinal segments. If there is a unilateral fixation on one side that can move more than the other, then it's likely a visceral issue. If it's both sides, then it's a mechanical issue. So that's when your chiropractors and physios can be really, really helpful. The kidneys regulate flow to the lower back and lower limbs. So any restriction in the kidney will often present as one-sided lower back pain or knee pain. Going down, we have the mesentery, which anchors onto the spine across L3. The mesentery feeds the small intestine. So in my experience, tension in the mesentery will often create hyperlordosis or excess curve in the lower back, which will give you the need to stretch it out by bending forward. And it's putting you into a lordosis because it's likely inflamed due to dietary choices, we'll call them. The small intestine can regulate flow down into the pelvis, and anyone with endometriosis can tell you exactly what that feels like, I suppose. Next, we have the large intestine. The large intestine is made up of, starting from the lower right, the cecum, the ascending colon, hepatic flexure, transverse colon, splenic flexure, descending colon, sigmoid, and rectum. The rectum, sigmoid, and cecum's on the right, sigmoid's on the left, they often, when they're blocked up, if someone's constipated, as an example, it can directly swell the colon. The colon backs up onto the sciatic distribution. So that can be a creation of lower back pain. But also the fascia surrounding the ascending, descending parts of the colon, the fascia of Tolt, they will also restrict flow down to the legs. But the lower parts of the colon have more of a direct flow-on effect to the lower back, where the upper parts of the colon, the flexures of the colon, they typically affect the shoulders more. However, because they articulate on the right with the kidney and the liver, left with the spleen, kidney, and stomach, it can create issues with the stomach and the liver, giving the illusion of, say, sciatic dysfunction. But that's secondary to colon dysfunction as well. Then we have the bladder at the front of the pelvis. In my experience, that's been involved in a lot of sacroiliac joint dysfunctions and pelvic floor dysfunctions. A lot of people go to a physio or a pelvic floor specialist to try and get their pelvic floor either released or functioning one muscle at a time. But the pelvic floor is 22 to 24 muscles. So it's quite hard to isolate one of those. They're all designed to come together as a unit. And if we induce pelvic floor stability without having first worked with the tensions of the bladder, especially if there's a unilateral tensional rotation there, we're going to further engram dysfunction into the system. So the bladder needs to be released. then the pelvic floor is now rehabable, if that's a word. Now, any female can tell you what it's like around in their menstrual cycle. When they're menstruating, the uterus will swell up and it can create pulling on an ovary or a uterine tube, which can create a rotation of the uterus via the round ligament. And that can create the entire pelvis to shift in an attempt to ease pressure off the uterus. And that's where a lot of pelvic torsions come from in females, but also the estrogenic effect can also throw out the upper neck. So it's a bidirectional relationship. With males and prostates, the prostate has an intimate relationship with the bladder, prostate being more of a half glandular, half organ or half gland. The prostate doesn't create its own problems, and often prostates will become dysfunctional when the male's been sitting all day or being quite inactive. The prostate needs to be able to move, needs motility. And if it doesn't, it becomes stagnant. And anything that becomes stagnant in nature invites a fungal infection, then maybe a parasite infection. And then that's how often a lot of cancers in the prostate get started. So we just need lower back and pelvic motility to help out all of those. And then you have the rectum at the back as well. And that can cause a lot of lower back cramping and spasming as well, because the bladder, uterus / prostate, rectum, and sacrum all need to be in a line. And if they're not in alignment, it creates an asymmetrical torque within that aponeurosis, which ultimately the pelvis needs to be able to move in an attempt to try and line it up, similar with the teeth, but this time downstairs with the pelvic organs. So that's how the organs can affect our lower back. Next, we go into the pelvis itself. So the most common pelvic, contribution to lower back pain would be sacroiliac issues. The sacroiliac is the marriage of the sacrum and the ilium, creating the sacroiliac joint. It's quite a powerful joint, and it takes the weight of the entire spine plus the force from our lower limbs. So it's designed by nature to be a very sturdy joint, but when we get issues here, it will often present, it can be a rotated pelvis. It'll often feel like you'll have one glute tighter on one side, and then the opposite hip flexor will be tight relative to the other. So example, your right glute and your left hip flexor might be tight relative to your left glute and your right hip flexor. So that's a sign of sacroiliac dysfunction. When you're walking along and one arm is swinging more, that's a sign of a sacroiliac dysfunction. Or when you're walking, instead of rotating through your torso, you actually move side to side. And that's called a compensatory Trendelenburg effect. Or Trendelenburg is when you're walking and then one hip slips out more than the other. That indication that glute isn't firing, which is secondary to sacroiliac joint dysfunction. That's a Trendelenburg effect. A big part of sacroiliac issues is also the coccyx. Now, anytime we've had a fall on the coccyx, anytime in life, you would have likely jarred the joints in the coccygeal junction, and that doesn't heal by itself. So you need to find someone who's skilled in releasing that. Now, all the ligaments of the sacroiliac joint also anchor onto the coccyx. So for me, they're kind of inseparable. You can't treat one or work with one without the other as well. And the end of the nervous system, the filum terminale externum, attaches onto the coccyx. So if you trace the fascia from the coccyx all the way up through the spinal cord, wrapping around through the cranial fascia, it actually attaches into the whites of your eyes. That's actually fascia. So anytime you look left or right, up or down, you're actually having an effect on the coccyx. Now we go into the lower limbs. Now, any foot dysfunction can translate into lower back pain just due to the mechanical forces not being evenly distributed throughout the kinetic chain, it'll often present possibly as knee dysfunction first. A lot of therapists think of the knee as like a dumb joint between the feet and the pelvis, where in reality, your knee requires a great deal of neurological finesse in able to do its job. And if there's any blockage between the receptors in the foot and the cerebellum in the brain, then it can and often does present as knee pain, which often correlates with either ovarian issues in women or kidney in men in particular. So that's just a brief, really 101, I guess, guide, if you will, on lower back pain. If you like, we can do more on lower back pain and what to do. But as you can see, just from what I've shared today, it can be quite extensive and can quite go into quite a lot of depth with a lot of it. However, we are more than happy to help. So I hope you find that informative. If you like this episode, please share it and leave us a warm review. If not, that's totally fine as well. We'll keep that our little secret. Until next time, bye-bye.
You've been listening to The Wizard and the Priestess. Thanks for stopping by. Stay connected and be open.